begin by introducing some of the leading voices in the field of blood health and neurology. Experts like Dr. Alessio Fasano, Dr. David Perlmutter, Dr. William Davis, Dr. Stephanie Seneff, Dr. Tim O'Shea, Dr. Sherri Tenpenny, Dr. Lawrence Palevsky, and Dr. Tom O'Brien have all contributed valuable insights into the complex relationship between blood viscosity, clotting, and stroke risk. Their research and clinical experience help us understand why blood flow is so critical to our overall health, and how small changes in our blood can have big impacts on our bodies. Blood viscosity refers to how easily blood flows through your vessels. Imagine water versus syrup. Our blood is about 5 times as viscous as water, meaning it's thicker and flows more slowly. This thickness is determined by the amount of red blood cells and proteins in your blood. The more red blood cells and proteins, the thicker your blood becomes. This is important because if blood is too thick, it can slow down circulation and increase the risk of clots. Hematocrit, the ratio of red blood cells to total blood volume, should ideally be under 45% to keep blood flowing smoothly. Blood viscosity is a key factor in determining whether your blood is more likely to thin or clot. If your blood flows slowly, red blood cells and plasma proteins interact more, increasing the chance they'll stick together and form clots. While clotting is essential for healing injuries, it becomes dangerous when clots form where they shouldn't, like in your veins or arteries. This can block blood flow to vital organs, leading to serious health issues such as stroke or heart attack. Several factors can influence your blood's thickness. Hydration levels, inflammation, insulin and blood sugar, triglycerides, red blood cell aggregation, platelet aggregation, and oxygen levels all play a role. For example, dehydration makes blood thicker, while inflammation can increase clotting risk. Even your red blood cells' ability to change shape, called deformity, affects how easily blood flows. Keeping these factors in balance is crucial for healthy circulation and reducing your risk of dangerous clots. Blood clots are clumps of blood that have changed from a liquid to a semi-solid state. While clotting is a natural and necessary process to stop bleeding, problems arise when clots form inside your veins or arteries without an injury. Sometimes, these clots resolve on their own, but in other cases, they can become life-threatening if they block blood flow to the brain, heart, or lungs. Recognizing the difference between helpful and harmful clots is key to understanding your risk. When blood clots block blood flow to the brain, a stroke can occur. If they block the heart's blood flow, it can cause a heart attack. Symptoms of a heart attack include chest pain, shortness of breath, fatigue, and pain radiating to the arms, jaw, or neck. For strokes, symptoms can include sudden headache, confusion, numbness, or loss of balance. Recognizing these warning signs early can be life-saving. Clot that forms in your leg is called deep vein thrombosis, or DVT. Symptoms include pain, swelling, tenderness, reddish skin, and warmth in the affected area. DVTs are dangerous because they can break off and travel to your lungs, causing a pulmonary embolism, a potentially fatal condition. If you notice these symptoms, especially if they come on suddenly, it's important to seek medical attention right away. Pulmonary embolism, or PE, occurs when a blood clot travels to your lungs. This can cause chest pain, shortness of breath, rapid heart rate, and even coughing up blood. Because a PE slows your oxygen flow, you may feel winded or unable to catch your breath, especially with sudden onset. This is a medical emergency and requires immediate attention to prevent serious complications or death. Stroke happens when blood supply to the brain is reduced, either by a blockage or a leak in a blood vessel. This deprives brain tissue of oxygen, leading to damage. There are several types of cerebrovascular diseases, including stroke, aneurysm, and mini-strokes (TIAs. Causes can include blood clots, narrowed arteries, or vessel malformations. Without prompt treatment, strokes can lead to serious, long-term disabilities. There are different types of strokes, each with unique causes and effects. After a stroke, survivors may experience memory loss, trouble with language, depression, fatigue, and problems with coordination. Some may have partial paralysis or even epileptic fits. These aftereffects highlight the importance of prevention and early intervention, as recovery can be a long and challenging process. Treating blood clots and strokes often involves anticoagulants, or blood thinners, to reduce the risk of further clots. Compression stockings may be used for leg clots, while clot-busting drugs or surgical procedures can help dissolve or remove dangerous clots. In some cases, stents or filters are used to keep blood vessels open and prevent clots from reaching critical areas like the lungs. Chronic inflammation, gut dysbiosis, poor diet, obesity, smoking, hormone therapy, and a sedentary lifestyle all increase your risk of blood clots and stroke. Inflammation damages blood vessels, while unhealthy gut bacteria can trigger clotting. Diets high in processed foods, bad fats, and sugar contribute to these risks. Staying active, eating well, and avoiding smoking are key steps to protect your vascular health. Regular lab tests can help assess your risk for cerebrovascular disease. Important markers include homocysteine, fasting insulin, HbA1c, vitamin B12, vitamin D, and high-sensitivity C-reactive protein, Hs-CRP. Monitoring cholesterol, triglycerides, and blood pressure is also crucial. These tests provide valuable information for you and your healthcare provider to take preventive action and manage your health proactively. Anti-inflammatory diet is one of the best ways to reduce your risk of blood clots and stroke. Focus on removing refined sugars, unhealthy oils, processed foods, and additives. Instead, eat plenty of greens, vegetables, healthy fats, and omega-3 rich foods like fish and nuts. Supplements such as magnesium, vitamin D, and whole food powders like Barlilife can also support vascular health. Staying hydrated and choosing nutrient-dense foods are simple but powerful steps. Proper hydration is essential for healthy blood flow and detoxification. Drinking plenty of water, eating hydrating fruits and vegetables, and avoiding plastic bottles can all help. For energy and focus, your body needs ATP, the energy currency of cells. Products like Peak Endurance provide B vitamins and ATP to support muscle and brain function without the side effects of caffeine. Staying hydrated and energized is a foundation for overall health. Omega-3 fatty acids, especially DHA, are crucial for brain and nerve health. They help keep nerve cells flexible and reduce inflammation. Low levels of DHA are linked to memory loss, Alzheimer, and higher stroke risk. Including omega-3 rich foods or supplements in your diet can support cognitive function and help prevent degenerative conditions. Aim for a daily intake of at least 1,000 mg DHA for optimal benefits. While understanding blood viscosity, clotting, and stroke risk is empowering, it's important to remember that this information is not medical advice. Always consult with your healthcare provider before making changes.
Welcome. Today I'll show you exactly how to join Beautique and make your first purchase. I'll guide you through every step, from choosing your account type to completing your order. Start by opening the main menu to explore our mission and the products section. You can join as a customer for rewards or as a member to start your own business. The sign-up form is straightforward. Just enter your contact details and shipping information. Members will also provide a few extra details to set up their independent distributorship. Once registered, browse our full catalog and select the high-quality products you'd like to try. Once logged in, simply find your favorite products, add them to your cart, and click Checkout Now to complete your order. You're now ready to start your journey with Beautique. We're excited to have you with us.